I want to talk to you about drains. We put drains in surgery when we expect fluids and secretions to come. By using a closed system, we are able to measure how much drainage is coming through the markings on the bulb, and it prevents the bandages from getting dirty and soaked. The way drains work is the air is evacuated. The bulb wants to expand because this entry site is closed. It can only suction through that tube. And you can see when I open the tube, the bulb expands, okay? Now there is a one-way valve. You cannot push the content of the bulb into the tubing. You can only empty the bulb after measuring the amount, expelling the air, and now it is ready to suction the fluid through a one-way valve. As I open it, it is going to expand and suck the air into the reservoir. If there is fluid will be suctioned. Therefore, it is very important to understand that in order for the system to work properly, the reservoir should be devoid of any air and should be collapsed. And as it wants to expand, it will be sucking the fluid into it. Once the reservoir is fully expanded, it will not be able to suction anymore. And therefore, it needs to be emptied. Measurements are read as to how much fluid there is. The content is emptied out. The air is expelled. And the cover is placed. And now it is ready to function again.